It's no secret Maine is in the middle of an opioid crisis. It's hard not to know someone who's struggled with substance use, but state data shows there is hope. Maine's latest monthly overdose report from September shows there's been an almost 19% decrease of confirmed or suspected fatal overdoses this year compared to last. News Center Maine's Sam Olson has more.
In Portland specifically, police department staff say there's been a 60% drop in deadly overdoses in the city this year. They don't exactly know why, but they say encampment closures are likely a big reason. Experts I spoke to say this is good news, but say the reality is people are still dying.
Exactly. Yeah.
Bill Burns says he's rarely ever at his desk, but when he is, he gets a little bit of good news. Fewer people are dying in Portland from overdose.
It would be fascinating if people were really kind of trying to figure out epidemiologically, what is the cause for this? We don't know.
Department data shows from January 1st through November 8th of last year, 40 people had died from overdoses in the city. In the same period this year, 16 people died. Burns is Portland PD's substance use disorder liaison. He says there are a lot of factors contributing to this drop, and he thinks encampment closures are certainly one of them.
But the true answer is we don't know.
But Burns is trying to figure that out. He spends most of his time working with the city's unhoused population. Fentanyl, meth, and crack cocaine are most prevalent in the community here. He says people are becoming more cognizant of the dangers of fentanyl.
There's a lot of awareness about the dangers involved in using even one pill, because there's so much kind of fake prescription drugs out there that could be laced with deadly drugs. And I think that's hopefully starting to change things.
While the city's seen a drop in OD fatalities over the past year, department data shows the number of non-fatal overdoses where the person survives have simultaneously increased.
Substance use is just a raging crisis throughout the state. And so I'm not surprised to see overdose figures continue to increase.
Preble Street's vice president of social work says there are some folks who may not be technically dying from overdose, but they are dying from complications related to their substance use.
The reality is, people are still dying from substance use and opiate use in our community. The need for treatment and detox and mental health care is as important now as ever.
Andrew Bove says there's still a core group of unhoused people in Portland who still need shelter. He says once people find shelter, they're more likely to be connected to resources and the support they need. Bove and Burns also acknowledge substance use impacts more people than we may even realize.
Most everyone now in Maine probably knows somebody that struggles with substance use or opiate use. And it could happen really to anybody, any one of us.
We're still in the middle of a huge kind of crisis that more and more people are being caught up in use that could end up killing them.
While the recovery community says there is still more work to be done to help get people into recovery, the director of Maine's opioid response highlights the role community coalitions have played to address substance use disorder in our communities. You can find more information on these coalitions and other resources on our website and mobile app. Sam Olson, News Center, Maine.